Well, I want to thank everyone for being here today. My name is Ed Kelly. I've been with the State of Nevada Community-Based Care Unit for 24 years. So when I started with the state, intellectually I understood about aging. I was in my late 30s. Now I'm coming up on 63, and I have a better understanding of what kind of issues my clients face. As you approach that age, you begin to feel the aches and pains and all the challenges of aging. So I want to say thank you very much for the honor of being able to serve the state, and want to make sure that you have my phone number. I left my cards with Jasmine. My phone number is on the back of those cards. So if there's any information we go over today, there's lots of information. If you have questions, please call me. I'll be glad to answer them in detail for you. So I'm just kind of here to give you a kind of a broad overview of the various programs that the State of Nevada Division for Aging and Disability Services Community-Based Care Unit provides. One of the things, we have an intake line that operates from 8 to 5, Monday to Friday, and we get every kind of question that comes in, primarily for folks that want to make referrals to these various programs. But one of the things I hear very clearly is just a great anxiety about, my mom and dad have certainly reached an age and they're not really taking care of themselves anymore, and I really need to have these services now. And one of the challenges that we have is because of the high demand for these services. You've probably seen the demographics that the aging population is growing in Nevada, and that by, I think, 2050, it's approaching 40% of the population will be 60 or older. So the demands for these services are only going to continue to grow. And one of the disappointing things I have to tell folks is if you called today to the division and asked to be put on a waiting list, you're looking for most of the programs up to a year. So it's not an immediate answer. That doesn't mean that it couldn't move quicker than that depending upon people that come off the list, but on the average we're running about a year. So if you know of someone in the community or have a parent that you're thinking about might need more supportive services, call as soon as possible. As you can see from the handout, the basic mission statement: to develop, coordinate, and deliver a comprehensive support system in order for Nevada's senior citizens and citizens with a disability to lead independent, meaningful, and dignified lives. About 8 years ago, they started bringing in combining programs, and I think it's about almost 4 years ago now, we assumed the disability waiver. It used to be called the WIN program, Waiver for Independent Nevadans. Now it's called the Personal Disabilities Waiver. So we actually serve now in the division everywhere from 18 up to, my oldest client was 105. So a broad range of ages. And the main thing is to allow people to have the autonomy, the power to be able to choose to be in their home. I've had the great honor of seeing a lot of our folks be able to stay at home to the day they pass or to very close to the end of the day they pass. No one wants to be in an institution. Institutions, I'm not here to say negative things about them. They serve a purpose. Sometimes people, even clients that we have, reach a point where they need skilled care and they can't stay in their homes any longer because the care needs become more than what can be provided in the home. But for the most part, our hope is that we can keep people at home as long as they possibly want and keep them there in the environment that they want to be in. The community-based care programs are there to enable seniors and people with disabilities to stay as independent as possible, give them choices to help them remain safe in both the community and group care settings. All programs are voluntary, and the applicant recipient have the right to self-determination. So when someone calls in to division and makes a referral, we have had this happen where a couple of weeks later they call in and say, I've changed my mind, I don't want to be part of this program, and we'll just disenroll them. So it's not like you give them your information and then you're locked into the system. Totally a voluntary program. And I'll talk a little bit later about some of the dimensions of financial eligibility that raise some questions when people call in. One of the first programs we want to talk about is one of the non-waiver programs. We have folks in the community that still can bathe themselves and get in the shower, but they just don't have the physical stamina to be able to do their homemaking anymore. So we provide an hour and 3/4 a week. Someone will come out, a homemaker will come out and provide basic instrumental activities of daily living, homemaking, shopping, meal preparation, helping them keep their environment straight and in order. It's not a lot of time, but for some, that hour and 3/4 is the difference between that or being in a very chaotic environment. I can tell you over the years, I've gone into a lot of homes where we do have a growing problem with some of our seniors where they don't know how to throw things away. And you walk in, I went into the home of a gentleman a couple weeks ago, and he had pathways, where he could get around, and he was alert and oriented, and he knew how to make it through the pathways, but it's a very high fire risk. There's just so much. And I'll ask him, would you like someone to come in and organize? Well, no, I know where everything is, and I don't want anyone to touch it. So we do see that more often. And the only time our elder protective, we also have a unit, an elder protective service unit. I'll talk about that later. But the only time we'd involve them if we felt the person was living in those kind of conditions and were no longer alert and oriented and not able to understand the safety risks they were placing themselves at. So as I said, the Homemaker program provides 1 3/4 hours of services per week. And right now, it's based on federal poverty guidelines, which is $1,079 gross income or less for an individual. So if they have income over $1,079, the first thing we would do is refer them to the Clark County Homemaker program. Clark County also maintains a Homemaker program that does some of the same similar things that this program does. The idea for this program, though, is to help them see what services they need. And we have a lot of folks that are on our Homemaker program that then transition over to the waivers. They get to a point where they can no longer maintain their activities of daily living, bathing, grooming, dressing, and then we process them to move on to the waiver. So as I said, for the Homemaker program, 110% federal poverty level or less, which is for 2015. They haven't updated it for 2016. It's still $1,079 for one person or $1,460 living for a couple. Now, if it's a couple situation, both members of the couple have to be enfeebled enough that they can't, provide these tasks. If a spouse was able to do it, we wouldn't send a Homemaker in. But we do have a lot of circumstances where the individuals have, both the husband and wife are no longer able to do these tasks, so the Homemaker would be provided. Yes, ma'am?
What if it was a household, if they had other family members living?
No, because if there's younger adults, then the expectation is that those individuals will be providing that help.
What if there's older adults helping younger people?
We see more and more of that. I have one client right now, and her 95-year-old father is assisting her. She's only in her 40s. And but for the Homemaker program, we look at the environment to see who's there. The vast majority of the Homemaker clients are living alone or just living with a spouse.
But they might be eligible if you have this 90-year-old parent living with somebody.
Depending upon the circumstance, certainly. That'd be one that I'd encourage you to call and we could talk about.
Thank you.
Yeah. There's just so many different permutations of services that can happen. So that's why I always say, if you have questions, call and ask. I've got a lot of programs to go through, but essentially they have to be able to be cognitive enough to be able to choose the services and to be able to say, I want this Homemaker to come in and provide these services for me. The state in 1987 applied for our first Medicaid waiver, and that was granted, and the Medicaid waiver for the elderly is predicated on the idea that people want to stay in their homes, and with a little bit of support services in the home, that is possible. In 1999, the Supreme Court, you may have heard of the Olmstead decision. They were required to provide care for persons in their homes or that would otherwise be entitled to institutional services because there were two ladies, I believe it was in down south, either Georgia or Tennessee, and they were in an institutional setting and they wanted to be home. They felt that the nursing home was not a proper place for them. So the Olmstead decision came through. This has set up some protocols for us now that we have to make sure that everyone that calls in, we contact them within 7 days. We have to have an initial social work visit within 28 days, but then the clock starts, as I was explaining to you, about the year. So we may be able to have an initial contact very quickly, but in terms of doing the paperwork to get them on the program, we're running 11 months to a year. Nevada waived, so what the waiver stands for is the federal government waives your normal income limits. And this year, it's what is known as 3 times the poverty rate, so $21.99 in gross income and less than $2,000 in assets to qualify for the program. Now, this also has all kinds of permutations because sometimes you have couples that live together. And what would happen is if the individuals have assets up to a certain amount, Medicaid will allow them to put it in the spouse's name. So as long as the applicant has less than $2,000 in assets. It's not unlimited. I think the federal guideline is fairly significant. It's like in the 60 to 70,000 range. But most of our clients don't have that much at all. What I've found over the years, it's ironic, when I started in 92, it was $792 in income or less and $2,000 in assets. In 2016, it's $21.99 in income and $2,000 in assets. They never changed the asset limit. So what Medicaid will do is they will do a split for assets, as I said, up to a certain point. And what that means is the individual that's applying the assets in their name can't be more than $2,000. Now, another question that comes up is, I have people call up and the first thing they say is, I want my mom and dad to have these services, but I don't want them to lose their home. When you apply for Medicaid services, there is a rule called Medicaid estate recovery, which states if you own your own home, that is an asset, and you participate in the cost of your services. So what it means is after the person passes, and after their spouse either passes or sells the home, there's a lien for the cost of whatever services they've received under Medicaid. And that's what Medicaid estate recovery is, up to the level of whatever their equity in the home is. Now, some folks are only on a year and they may generate, a few thousand in services, so their lien would only be that much, and then the rest of whatever the home's value is, that would stay with the family. No one takes their home away. No one forces the spouse that's not on the program to be out of the home. It's only at the time that the house would be sold that would be exercised. So I know that raises a lot of questions, and we can talk more about that later. Recipients must meet a level of care. We have to give them a score of at least 3 with at least one activity of daily living, which means usually that they can't bathe safely. What's the number one reason people break their hips? Falls. And of those falls, a lot of them take place in the bathtub. So the idea of having that aid there to provide supportive services and make sure that person can transfer. We also, as our social workers bring them on, Medicaid allows for the payment for certain medical assistive equipment. So we have our clients get transfer benches and shower chairs, different adaptive things which allow them to be independent in the home. The shower bench, I'm sure a lot of you have seen it, where they can sit down and then swing their legs in so they're not trying to lift their leg over the shower, which is when most of the falls happen. You put that one leg in, your foot slips, and then you're down, and then it's broken hip time. So they need to be able to be prompted to take their medications. One of the federal rules is that the personal care attendants that come in cannot hand them medication. So we can remind them. A lot of them have these pill minders that the home health agencies can come in and set up by the week so that the medication is set up week by week. They have to have a need for some supervision. If they're totally independent, they don't need the waiver. I've got a lady I went to process about, this is a long time ago, 10 years ago now, and she met me in the door. It was at the Sartini Plaza, and she was in a tap dance uniform, and a neighbor had said, well, she looks like she could use some assistance. And I said, can you do a shower on yourself, or shower by yourself? And, oh, yes, I do all that myself. I'm going out to my tap dance routine now. So she did not meet a level of care. So they have to meet a level of care which shows that there's some risk factor for falls, for not being able to get their bathing, grooming, ambulation, and a lot of them have incontinence needs. One of the nice things about the waiver and becoming Medicaid eligible, Medicaid pays for the diapers and the pads for the bed, so that's a big assistance for them. Meal preparation, we see a lot of seniors that they lose weight because they just don't have the endurance or the time or the stamina to make meals for themselves anymore, so that aid can come in and assist with that. We assign a social worker, so every client has a social worker that will contact them on a monthly basis. And under the waiver, we also pay for adult day social model daycare. Daycares run anywhere from, some of them are open as early as 6:30, 7 o'clock to 6 o'clock at night. One of the primary questions I get from adult children that call me, they say, I need someone to come in and sit with mom all day. That's my primary need. And we explain to them, there is no resource for that. That's what daycare is created for, for a large block of time. We have under the Medicaid model, 6 hours a week of respite is all that's provided. So someone can come in for a 6-hour block to provide that primary caregiver with some relief. You know, it's a high burnout situation when you're taking care of a loved one 24 hours a day, 7 days a week. 6 hours a week isn't enough, but it's enough to get out, you know, to be able to shop or go to a movie or just get that emotional break that you need. If the individual is in a situation where the family member is concerned about them being alone, that's where we suggest the daycare option. And we have, I think there's currently 8 contracted under Medicaid, different parts of town, and they really provide a lot of relief to adults that are still trying to work, you know, trying to arrange schedules so they can still work and make sure the needs of their parents are taken care of. We can put in anywhere from 48 hours one time of chore service. This is like those clients I was telling you about where no one has picked up a dust rag for years and years, and there's lots of, you know, piles of detritus and things that have accumulated. So the chore service would go in and help rehabilitate that environment and help that apartment or that home to be more livable. And then under the waiver, there's also, we used to have a separate waiver called the group care waiver. They combine the waivers, but in group, we can provide services in group care homes. We have about 40 group care homes that are contracted with the state of Nevada, and we provide out what's called augmented personal care, which means we pay the facility an extra amount to be able to come in and make sure that person bathes safely and, you know, has their needs met. The group care guidelines are the same, $21.99 gross income or less, and less than $2,000 in cashable assets. So any questions about eligibility right now? Good. And I encourage you to call me if you think of questions after the fact. What you can't do is have $150,000 in a trust account, give it to your son, and then sign up for services. Because what Medicaid does, Medicaid has these incredible systems, computer systems that go back and can find everything. So they do what's called a 5-year look back. So if you have any kind of significant asset that you've surrendered to family within 5 years, then that would make you ineligible for a period of time.
Does that include your home too?
Not your home. The home is not counted and the car is not counted. But as I said, after the fact, there is a lien for the cost, if you own your home, for the cost of services. Up to the cost. Let's say a person is on the waiver for 2 years and they generate $15,000 worth of services. When the family would sell that house, put that house into escrow, there would be a lien to be satisfied for the cost of those services. So no one is ever forced to sell their home, but it's part of what's called Medicaid estate recovery. Yes, sir?
Could you explain the 5-year look back again?
Yeah, Medicaid does a 5-year look back. So they will look to see if any asset has been surrendered in the last 5 years. You know, folks that have, and a lot of times very well-meaning, they give something to the grandchildren or they want to, you know, assist with the family. But if it's a tangible asset and it's surrendered within that 5-year period, then it could make them ineligible for. There's so many permutations of this too. That's why I encourage people to call and ask, you know, give me particulars. In the group care, care must be provided in a licensed residential facility. I just left a group care home before I came here. Our social workers go in on a month-to-month basis to make sure that the medication logs and the logs for their bathing and other activities of daily living are kept up. The group care operators are trained that they have to document day by day by day in order to get paid. We have homes that are licensed by the Bureau of Healthcare Quality and Compliance for only the Alzheimer's population. So those homes have to be functionally secure, so either an alarm on the door or some way where the senior can't just walk away from that home. You know, you may have heard over the years there's been a couple of instances where that has happened, and the Bureau has worked really closely with the various group homes to make sure that they are secure. What happens in the larger group homes, sometimes you have 10, some of them are licensed for 10, 12 folks, and you know, they need to be making sure that no one is gaining access out that front door. There was a story a few years ago. It was a group of care down in the southeast, and they found the gentleman. Thankfully, he was just walking, and it was kind of a rural, you know, that kind of horse zone property, like east of the Strip, south of Warm Springs. He was just walking. He wasn't injured, but he was a good mile from the home. So thankfully, we haven't heard of that happening anytime recently. If an individual has income that meets the SSI guideline, which is supplemental security income. For the group care homes, it's under $1,024. They will apply for SSI for them, bring them up to $1,024. The group care home accepts $1,004 of that, and the individual is allowed to keep $120 for their personal spending. That's where they get the figure of $1,124. Most of the group homes, they want, I can find placements for folks that are low income like that, but most of them want a little bit more than that. I can't quote you the average. I know in the private sector you can look at anywhere from $3,000 to $5,000 a month for those services. Our clients don't have that. So what happens under the waiver provides 3 levels of service for personal care. We pay $20 a day or $600 a month, $45 a day for those that need a higher level of assistance. And I think that works out to about $13.50, and then $60 a day for those that are pretty close to being nursing home, have a lot of complications with their activities of daily living and really need a lot of assistance. If someone goes in a group care home and they end up becoming bedbound, the group care operator has the option of contacting the Bureau and getting what's called a bedbound waiver, so they don't necessarily have to be moved out of the group care home into a nursing home situation. If their level of care gets to be such, though, that it's no longer safe, then they would have to move into a more institutional setting. I have the great blessing of working with 40 social workers we have now, of all ages. And when I started, as I said, I was in my late 30s, and now I'm the old man there. So we have a lot of youngsters coming out of UNLV, very, very energetic, either you hear their stories, they choose to come with us because they've had an aged parent or a grandparent and they have a love for the elderly. And they assist with Medicaid applications. They'll come in and do the yearly Medicaid application for the individual. They'll advocate for services for that individual, what other services they might be able to access. They monitor the safety of their client. We have what's called a serious occurrence report. Anytime a client falls, the agencies that come in and provide the personal care have to let us know. We track hospitalizations. They make sure that the recipient retains their choice about their environment. One of the kind of downsides that I've faced over the years is that these agencies, the state contracts, we have about 45 different providing agencies that provide the personal care. And they don't pay a lot. The average aide is in probably the range of $11 to $12 an hour. The newer aides might be $10.50. And so you have a lot of turnover with those aides. Well, I've got cases where aides have been in for 4 or 5 years, the same aide. It's been very steady. But we also have situations where we have our seniors that give us feedback. We go out, we take a random sampling of clients and we go out and ask them about their services every year. And one of the main complaints I hear is, well, I'm on my 3rd personal care, they don't call them PCAs, but my 3rd lady is here. And that is very disruptive to a senior. A senior just gets used to teaching someone how to make my sandwich the way I like and how I like my bed made and how I like my homemaking done, and then this new person shows up. So I'm very thankful when we have those cases that have steady staffing. Administrative case management is there to make sure that they stay in the Medicaid system, that all their documentation for that is kept current, and then any questions the family has about their services or the client. When I first started this, I was taken to task because I went into one of my first home visits, and the lady was 94, and the daughter was probably in her late 60s, and I started talking to the daughter. And the 94-year-old turned to me and said, "Young man, I'm capable of answering my own questions." And I was so glad that I got that lesson early on. You go to the client first. You find out that person, and a lot of times they'll defer. "Oh, talk to my daughter, talk to my son." I don't know what you're asking me, but a lot of times, if the person is alert and oriented, they have the right to be able to determine their services. We shouldn't assume that because they're advanced age. The homemaking under the waiver is very similar to our Homemaker program: meal preparation, laundry services, light housekeeping. Shopping is interesting because a lot of our seniors shop coupons. And one of the downsides of the aides is they don't get gas mileage. For a lot of the agencies, don't provide them gas mileage. So, I always try to tell my social workers when they go in to talk to clients, make sure they understand that the aide can't go, to 15 different stops when they shop. They have to, at the holiday time, it might be different. They might be buying a gift for a grandchild or something. We certainly make arrangements for that, but not on a regular basis. They just don't have the ability to make several stops. And then to assist the recipient and family members or caregivers in learning homemaking routine and skills so the recipient may carry on normal living. So we try to, if the family, sometimes you go in and the families don't have a clue about what the client needs. So we look at the environment and try to give them some assistance as well about what they could do in the hours that aid isn't there that would facilitate making it safe for that client. As I touched on before, most of our clients go at least 4 days a week. We have a few that only go 3 days a week to the daycare. And these programs provide a midday meal. I was in one about 3 weeks ago, Nevada Adult Day Healthcare over on Jones, and they had a gentleman there that was there from, I forget, it was either Earth, Wind, and Fire or one of the soul groups from the 70s, and he had his karaoke machine, and there was 85 people singing along and having a great time. So they try to provide some form of daily entertainment. They all have bingo. That's a big deal, with them. And then a lot of the daycare centers provide their own transportation. They have their own vans, and this has been much more comprehensive in the last year. They've been able to reach some of the outlying areas. Nevada Adult Day Healthcare, I know, has one, I think once or twice a week, actually goes out to Pahrump and will pick people up to bring them in from Pahrump. So when you talk to these daycare centers, you want to ask them, what is your catchment area? What areas can you provide transportation to? We contract with Senior Companion, and a couple of the PCA agencies also have contracts for Adult Companion. They come, they can sit with them, write letters, be able to provide them that social contact that a lot of them do not have. Up till about 10 years ago, the Senior Companions could transport them, and then Catholic Charities found out that their insurance premiums were getting so prohibitive that they had to stop that. So the Senior Companion cannot transport the clients any longer, which was very hard for a lot of them, because that was the one resource they had to go out with their Senior Companion. Now, Senior Companion also has services in various of the larger buildings that are not part of our waiver, and some of those still have companions that can provide transportation. So, personal emergency responses, you've probably seen this, they advertise very heavily. They're a pendant, either wear around your neck or on your wrist. And we now have cellular units which actually are locked into the cellular tower so the individual can wear it and actually go out of their home. Most of our clients still get the landline-based units because they're home 95% of the time. The cellular-based units, our one concern is that if you're not near a tower and you fall, that tower, even if it picks up the signal, is just giving you a very general idea of where that senior is. Whereas if you're locked to your landline and you push that button, it's going to bring the address up on the screen. I had a lady that was a dear friend. She had resources, so she couldn't come on our program, but she did pay for one of these units privately. And she was fiercely independent about staying at home. I met her when she was 88, and when she was 92, a man came to her door. She lived on Vegas Drive in Decatur, so a neighborhood that was once a very solid neighborhood, but it's kind of been in transition. And this gentleman knocked on the door and said, "Where's the gas station?" And she said, "Honey, I don't know. I don't drive." She had macular degeneration, and she was wise enough never to tell anyone that she was, could see very poorly. And she said, "You need to go down to the corner and ask. Someone can help you there." He pushed her door open. He knocked her down. And he said, "Listen," and used an expletive. "You've got money in here, and I want it." She had her unit in her pocket, pushed the button. The operator came on. I'll say it's Mrs. Smith. That wasn't her name. "Mrs. Smith, are you okay?" And, "No, this man has knocked me down. Please help." And he ran out. And thankfully, she was able, after she had to go into rehab for a couple of weeks because she was so sore from falling, went back home, and she died in her home at the age of 94. Sitting every morning, her routine was to watch the Today Show. And we had a homemaker that she paid for privately, and I got a call from the homemaker, and the homemaker said, "Mrs. Smith is sitting in her chair, and I can't wake her up." So she'd gone to her chair, her tea was right there, and so she got her wish. She got to stay home. And that's what we want to see, is people that have the autonomy and the ability to stay where they want to be.
On those units,
yes.
If we wanted one for ourselves, how would you go about that? Contact you or?
If you wanted to pay privately, I can give you the resources. All the companies that we contract with have private units. I think the going rate is anywhere from 40 to 50 a month.
Well, I've got one now that's less than that, but it doesn't have the capabilities for outside.
Okay. Take my number and call me, and I'll give you the ones that have the cellular ability. I'd be glad to provide that for you. So one of the things that we also go in and encourage folks is don't have this unit and then leave it on your bedside table, because we have had those cases where a daughter has called us and said, I can't reach my mom. They just called the paramedics open up, the client is lying on the floor all night long, and the unit is 55 feet away. They couldn't reach it, because either they've injured themselves and they couldn't crawl to the unit. So we really encourage folks, if you have one of these units, keep it on your person so that something happens, it's there for you. I touched a little bit earlier. We have 6 hours.
A lady has a question.
Oh, yes, ma'am.
I was saying, have you explored using the Amazon Echoes that you can just yell at the machine and say,
That is a
"Call my daughter"?
great new technology, and those that have the resources, I'm sure we'll start seeing those in the homes.
Because you don't have to wear it around wherever they are.
Yeah.
And it's within range, they just shout at it and it'll guide whoever they want.
Yeah.
And it's a one-time cost, it's not a monthly.
Yeah. That'll probably provide great competition for these providers. Although they are trying to provide, and I know a lot of these providers are trying to diversify. They have these pill, dispensing machines. They have other things that they're trying to offer. So they probably see that that the marketplace is changing for this. We provide 6 hours a week, a maximum of no more than 336 hours per waiver year. And that's, as I said, for someone to come in to provide relief to that primary caregiver. Primary caregiving, I think last year President Obama said that it was approaching $3 to $3.5 billion of unpaid care that's provided. I mean, the hours that adult children and other family members put in to provide care, and they're our unsung heroes. A lot of our clients, they wouldn't be in the home and sitting on our waiting list if it weren't for the fact that they had a daughter or a son or a family member or even a neighbor sometime that's providing enough of that emergency net for them to be able to stay in their homes.
I'm sorry.
Yes, sir.
Describe who provides the respite care 6 hours a week? Is it the Cleveland Clinic or is it your?
The provider agencies. So usually what happens is the clients don't want to have another stranger coming in, so they'll ask, can I have my PCA be the respite person?
And the PCA is?
The personal care aide. The person that comes in and provides the bathing and the homemaking. So, yes, ma'am.
When my husband was incapacitated and paralyzed for 12 years, I cared for him. And they offered me respite. And in my case, they would have put him in a care unit.
Right.
And I would have been at home and had the break.
Right.
But he didn't want to, so I didn't take it.
Right. There are different grants in the community, and if you call a division, my main number for the division, we have what's called the community advocate, and she tracks grants that are available, and sometimes there's respite grants. I know the Alzheimer's Association has a respite grant as well. There are those nursing homes that, if census permits, they will admit folks for respite, for a few days at a time to provide that primary caregiver. But strictly under our waiver, it's just the 6 hours a week that we provide.
And
Yes?
Can you combine, if you don't use it on a weekly basis, can it be combined at all?
That is the $64,000 question that we're going through, because we also have respite on our younger waiver, and that is 120 hours a year. And what we've come to realize is that for that population, they want to save it up. Instead of using 10 hours a month, they want to take a weekend, or take several days in a row. So we are looking at that right now. Right now, for the aged waiver, it's the 6 hours a week. So that question is coming up more and more, though. We've talked about Shore. The assisted living waiver, we have two facilities, one on Silver Sky, which is near Durango and Westcliff. The other one is at 215 in North Decatur, called Deer Springs Silver Sky. And those are buildings that meet the federal guidelines for assisted living. You have to apply to make sure that you meet the guidelines for federal housing. And those are based on the same eligibility, $21.99 or less in income and less than $2,000 in assets. But the great advantage of these apartments, every apartment in these buildings are handicapped, ADA compliant. The sinks, for instance, have no cabinets underneath, so you can roll your wheelchair right up under the sink. They are all single units, so a husband and wife or a single person doesn't have to worry about a roommate. Most of the group care homes have roommate situations. A lot of the group care homes, if you want to have a room to yourself, then that's an additional cost. And I know, I talk to a lot of my folks that are considering going to group care, and that's one of the big stumbling blocks. They say, I haven't had a roommate since college, and I'm not real interested in the idea, at 75 of suddenly having to deal with a roommate. Sometimes, though, those situations work out. I've seen it happen where the roommate becomes the best of friends. That person's been isolated, and it provides them a way of having some socialization. But you can certainly understand that for most folks, the idea of making that transition can be kind of scary at first. Similar to our other waiver cases, we provide case management. The social workers come out. We have to meet, as I said, the guidelines for low-income tax credits through the housing division, so that's an extra application you do. And we only have 2 facilities, and both of them are in Las Vegas. If you're living up in the Reno area, we don't have them up there yet. They're looking at adding that at some point in the future. And their reimbursement rates are based on the recipient's assessed level of service. Same thing, $20 a day, $45 a day, or $60 a day is what the state pays to assist with their personal care, depending upon their level of need. Now, if you have more than the $21.99 or more than $2,000 in assets, we have a state-funded program called COPE, the Community Options Program for the Elderly. And they have to, as I said, meet these guidelines. These are all means-tested programs. The couple can have up to $30,000 in assets and still qualify. And it's very similar to the waiver. It sends a personal care aide in to provide personal care, homemaking, chore service, all the services that are provided under. We have daycare, and that's paid for out of state general funds. So there's no Medicaid dollars involved with this. Yes, ma'am.
When you talk about income above $21.99 not to exceed, is that annual income?
No,
or
monthly.
Is that assets?
Monthly.
Oh,
Monthly income. The individual that's applying for cannot have an income.
Because you use the word assets, and I'm thinking, my God, there must be a million people entitled for this.
Well, assets top out for the couple of $30,000 on this program. Income is $3,099 for the individual. So we could have both members of a couple on and they could each have an income as long as their income was under that, and their combined assets weren't $30,000.
Here's the asset.
Yeah.
Is that a gross income?
Yeah. You have to figure in what's taken out for Part B Medicare. So whatever the gross amount of their income is. And it's, as I said, similar services to what you receive on the waiver. If you, this doesn't come up very often, but we have had folks, we need to let them know that their income may be low enough to qualify for the waiver, but they have $6,000 or $7,000 in assets. This program requires that little by little they spend down those assets to qualify for Medicaid, because we want to move them on to the Medicaid program. So we had only one case in the last year where the folks turned us down because they didn't own a home, and they understood that if they spent their income down or spent their assets down and then could qualify for Medicaid, that the Medicaid estate recovery would apply, and they didn't want to be involved with that. But we operate under Nevada Revised Statute 426. It prioritizes elderly recipients needing substantial assistance with bathing, toiling, and eating. And those recipients assessed with great risk and a very high level of care. So this is what we use as our basis for looking at who qualifies for the COPE program, and also in terms of how we prioritize the list. That one-year waiting list has very few exceptions. One of the exceptions is if we get a case where the protective service calls us and the person is in great dire need and there's no support system, that's a consideration. We also look at nursing home discharge. If an individual is in a nursing home but wants to return home, they get some priority. There's another program that Medicaid runs called Focus, which is to assist those that are trying to, are alert and oriented and do not want to remain in a nursing home situation and want to return home. But for the most part, as I said, the average waiting time is a year. Another program that was designed for the younger disabled, meaning 18, all the way up, we have some that are up to their 60s on this, is the Personal Assistance Service Program. This is a program that will help folks up to 35 hours per week with services. We have to have documentation from their doctor that there is a severe physical disability that allows them, that makes them unable to provide for their activities of daily living. In other words, they can't get in the bathtub safely, they can't cook for themselves, they can't. And we actually have younger disabled folks that receive these services and still are able to go to college. We have one gentleman that's on this program, and he's a Clark County School District teacher. And he is a quad, and he's able to, with the assistance that's provided, they get him ready in the morning, and he's able to go and teach. So it's a wonderful program. It's limited in terms of the slot numbers we have. They must not be eligible for Medicaid, Nevada Medicaid, so they have to be over. If they do if they have change in income or assets, then we would process them for Medicaid. The program has no asset limit. That's one of the benefits of it. It must require assistance with two of the following. They must either need bathing, toilet, and reading, two of those three. And then, unlike a lot of the Medicaid programs, caregivers can be paid, can be family members or a spouse. The Medicaid program will pay for a family member to provide the personal care if the individual elects to do it, but they will not pay for a guardian or a spouse to do it, unless the spouse is enfeebled too, and the doctor, gives us documentation that shows, well, the spouse would not be able to provide these services. But the PAS program has provided some great flexibility for the disabled population to keep them in their homes. And as I said, 35 hours a week for some is still not a lot. When you have someone that is, severely compromised, that's only 5 hours a day. So not a lot. Yes, ma'am, do you have a question?
I don't know.
Oh, okay. Okay. For both programs, they have to be older, 18 years or older, reside in the state of Nevada. That's another question I get frequently. I get calls from out of state, and they say, my mom and dad are going downhill. I'm moving to Nevada next month. I want to get them on the waiting list. Fortunately, I cannot take a referral until they're physically in the state. So the clock can't start until they're in the state. And I encourage people too. Sometimes, I call it jumping out of the fire and pan into the fire. If you have services in place in California, one of the primary reasons we see people that are moving up here is because the cost of living is so escalated in California. It's got so expensive. But there may be services they're accessing up there that when they come here they can't find. And also the waiting list. So I tell people, be very careful, before you make that move, to understand that you have to have support services in place to help you until such times as we can, get you up the waiting list and provide these services. The diagnosis for the PAS program has to come from their primary care physician to show what the physical disability is that disallows them from participating in those tasks. If they have to be alert and oriented to be able to supervise their attendant in order to be able to direct them as to how they want their care to be provided for them, and demonstrating an understanding and willingness to utilize available personal and financial resources, which essentially means if they have resources for things that the program doesn't provide, that they will provide for themselves if available. And they must be a U.S. citizen or an alien legally admitted. So you must at least be, for any Medicaid program, you must have status as an admitted citizen, or a green card status. If you have no status at all, then we can't do any of these applications. Similar to the waivers, I won't go over dressing, grooming, meal preparation, laundry. They can do range of motion. They can't do that in the Medicaid program. That requires a PT to come in. But under this program, if they're trained, family members trained, they can provide limited range of motion. And then the self-directed skilled services at the bottom, you see there, that is like individuals that have like a feeding tube or a G-tube, and if they're alert and oriented and they want to train an individual to provide those services so they don't have to rely upon a skilled person coming in to provide that, they can do that. Excuse me. A case manager would be assigned as similar to the waiver, to provide monthly contact with an individual. And then payment will not be made for services provided outside the state of Nevada. For instance, if this person goes on vacation and something occurs, there's no resource for that. Under Medicaid, they actually, if you're in an emergency room, There's certain circumstances where Medicaid, you're on a trip out of state, and you can show that it was not anticipated that Medicaid will cover the cost of some of the services. A recipient in the PAS program may not be enrolled in the Homemaker program, so they can't have dual enrollment. And once again, PAS stands for Personal Assistance Services. This is to help those individuals, mostly the younger disabled, that still are trying to pay bills, managing a checkbook, helping them, to do those things that allow them to meet the daily, monthly demands of living in their own living space. And they will help them to see if there's other programs in the community, like through Social Security or through Medicaid, that they would be eligible for, to apply for. As I said, 4 years ago, the governor decided that it didn't make sense to have the younger disabled population over with Medicaid in a separate division, so they've all been combined together. So we actually have services under the physical disability waiver. It used to be called WIN, now it's the PD waiver, waiver for persons with physical disability, same as the Medicaid waiver for the elderly under $21.99 in income, under $2,000 in assets. There has to be documentation from a physician showing what their disability is. And they must meet all the same guidelines of the program, the income and asset guidelines. They must get a level of care score of at least 3, which is usually bathing plus 2 instrumental activities of daily living, homemaking, meal preparation, shopping. They must demonstrate a continued need for these services to prevent placement in a nursing facility. I processed a lady when I first started, way over in 1993, and she passed away in 2014. And she was very much in need. I thought that she was going to go in the nursing home when I processed her, but she managed to stay on the program for all those years. So I see more the case where a family calls us, and an individual is at a point where they're getting in need of a lot of assistance. I'd say the average client we have probably no more than a year or 2 on the program, but it can differ from client to client. We love to see these clients so they can stay in their home for long periods of time. For the younger disabled, we have residential care services to assist them. I've not had any clients, so I'm not really conversant with how that goes about, but we try to find resources in the community for the younger disabled that want to remain in the community and can find a living environment that provides those supports for them. And then under the waiver, there's also a stipend that allows them to pay for things like doors to be widened to accommodate wheelchairs, ramps, modifications to the shower, anything that will facilitate their health and safety. It provides a PERS unit as similar to the aged waiver. And then they also have 3 different contractors that provides home delivered meals. They get a month's supply of meals that are delivered to their home, frozen. And I get good feedback from that for most part. Some folks don't like it because their taste buds just are not. It's hard to meet individual tastes. We see the same thing with the Meals on Wheels program through Catholic Charities. They can't over salt or sugar or put a lot of condiments in. So we often encourage folks, well, try it and then see if you can adjust it to your taste and liking. Specialized medical equipment, we have grant monies that also will help them get things like Hoyer lifts, like for those that are bedbound, to assist them to transfer out of their bed into the wheelchair. And then case management. As I said, the social workers are in regular contact on a monthly basis with them. I wish there was no waiting lists. I wish that was not the case, but as I said, the average wait time is going to be approaching a year for these services. Some difference for the state-funded program, COPE might be a little bit shorter. And then we look at whether they're currently institutionalized, what a level of care score is. So high scores, they're in crisis, or we're getting referrals from, as I say, Elder Protective Services. So there's kind of a crisis situation that really needs to be met. So our intake number is on my card, 486-3545. We're open 8 to 5, Monday to Friday. I encourage you, to call my number on the back with particular questions you have, because this is a lot of information. It's like trying to drink out of a fire hose to pick it all up. When we process the individual, we have to have their date of birth, their Social Security number. We have to meet all HIPAA guidelines, so all records are kept locked, Computers are not left open at night. All computers are locked with, a code so that no one can come in our office and access that information. And we have actually people that come in the office and randomly come through and look at our computers, and we get feedback about, your computer screen was open. So we take it very seriously, that nothing is compromised in terms of that person's information. It amazes me how many seniors, though, and it's one of the scams that we had running about 2 years ago, where people would call up and say, I'm from the Social Security Administration, and we found $5,000 that's to you. I just need to verify your Social Security number. And once you give them that number, you've unlocked your life. So we constantly telling our clients, please make sure, know who you're talking to. Don't give that information unless you know for sure that it's a reliable source. When I do intake, it amazes me, what's your Social Security number? And they rattle it off. And I always tell them, I give them my little speech about make sure, you know who I am, but make sure you never do that with a stranger. So you call into our office. Within 7 days, someone will call back to verify and make sure that it's an appropriate referral. And then we'll send a social worker out to make an initial assessment in 28 days. But that's not to get them officially on the program. That's just to make sure that they're appropriate for the program. And then the clock starts. Here's our websites. There's also NevadaAging.net. It just was updated. It's on my card, agingservices.net, I believe, but call me and I'll provide that for you. But there's a whole wealth of services there. And also if you go to nv.gov and then click on agencies, under Health and Human Services, all the agencies that provide health and human services are provided there with all the descriptions of the programs and the income guidelines and what it requires. We have 4 offices: Carson City, Reno, Las Vegas. We're at Burnham and Burnham and Sahara. So we're I always say halfway between Maryland and Eastern, although we're a little close to Eastern. So I encourage you, come down to the office and walk in, and we'd be glad to answer questions in person for you. And some more websites, and it's on the back page of the presentation that I have. And I also left for Jasmine my presentation, so she has that as well. So questions you have? A lot of information to. And I want to thank you. Yes, sir.
If you had a large amount of assets, could you theoretically buy a new house with those assets?
If you have assets, you can buy a house, but you have to live in that house.
Right. So, if you had like $500,000, you buy a $500,000 house, live in that house.
If that was your primary residence, Medicaid allows you to have a primary residence, yeah. But when you pass,
Right.
It'll be a state recovery.
But if you were leaving that house to your relatives, then
I always tell
all
people,
that money would get transferred.
there's an office of estate recovery up in Carson. Those kind of questions, I always refer them because I don't want to give anyone misinformation. But my understanding is if you're the primary applicant and your name is on the deed, there's going to be some level of involvement with that. The family can still inherit the house,
Right.
but when they sell it, that lien is still going to be there. That's my understanding. So, one of the things I also tell folks, we've had very little problem with this over the years, but if you come on one of these programs, if you have anything that's precious to you, like diamonds or any kind of jewelry or anything that you don't want to lose, I always tell people lock it up until you know for sure that aid is coming in. Now we've been very little, thankfully, over the years, very little. But there have been cases where folks have found things missing. And then I've also had cases where a client has called me up and said, oh, I want to get rid of Mary. She took I had $300 and it was stuck down in my chair and it's missing. And then this happened about a year ago. About 5 days later, this lady called up and very sheepishly said, can I get Mary back? And I said, well, what happened? She says, well, I found the money. I put it someplace else. But that makes it difficult for that relationship because once you've said to someone, you stole from me, I think if my memory serves me, though, Mary was willing to go back. So, because a lot of the aides they're trained. We've required that the agencies that contract with the state provide them training about the nature of serving the elderly. And that confusion and that these kind of things can happen, and not to take it personally. So, any other questions? If you want to write my number down, if you don't get a card, somehow my direct line is.
More
Jasmine. Yeah. I brought 30, so there should be enough cards for everyone.